Let me give people an update on where we are in the state of California. In particular, in the last 4 days, we have seen a doubling of the number of hospitalizations related to COVID-19. In the last 4 days, double the population that's been hospitalized. We've also seen a tripling of the number of ICU patients in our system in the last 4 days. These have long been projected based upon our modeling. Consequence, we have for weeks now been organizing ourselves around a surge that will require roughly 2/3 increase in capacity within our hospital system. That requires three fundamental things. It requires finding new places to put people. Number two, requires having adequate supplies from PPEs to the ventilators. And importantly, number three, requires people. And today we are announcing a new effort, healthcore.ca.gov, that will provide a platform to match individuals that may have retired in the last 5 years, may be in the process of getting licensed or relicensed, people that are in nursing schools or medical schools that are nearing the completion of those efforts, to incorporate and encourage them to get on this platform to provide for the kind of human capital surge that we'll need to meet the moment over the course of the next number of weeks as these numbers continue to rise. We couldn't be more pleased by the incredible professionalism of our nurses and doctors, our professional representatives that came together across many differences and organized around a framework of providing more flexibility, more surge capacity within the system, by providing scope of practice reforms, by allowing us to utilize our existing resources in a more resourceful way. I want to thank all of the representatives for putting aside, again, those differences and meeting this moment head on to provide the flexibility that is required to meet this moment. We have an executive order that went out that will provide flexibility through June 30th. This is temporary flexibility on staffing ratios, on scope of practice for nurse practitioners, EMTs, and others. We are going out now to deeply find the kind of talent, though, that is necessary beyond the scope of practice changes and beyond the regulatory changes to make sure that we have the adequate workforce, looking for mental health experts, looking for more EMTs, more pharmacists, looking for more phlebotomists, looking for more experts in respiratory care and the like, technicians, administrators, doctors, nurses. We are calling on you to step up and step in and meet this moment. We have more licensed healthcare professionals in the state of California than any state in the nation, some 766,000 professionals in the state of California. But we estimate we have the capacity to increase our ranks by an additional 37,000 plus professionals that are in that time of life where they, again, may have just recently retired, or they're in the process of getting their license and their degrees. And so we are very, very hopeful with this effort that we will see a surge of individuals to be paid and compensated to participate in the workforce and distributed throughout our care delivery system all around the state of California.